Thank you. It's a real pleasure to be able to speak with you today about a brand new undertaking that we are so excited to be um, launching called the Certified Wellness Coach Program. And this brand new profession is intended to serve individuals, children through age 25, to meet um, issues that lead up to a need for mental health care. So I'm gonna talk about our bigger initiative that we're a part of, um, and our new wellness coach. Next slide. Um, um, and then discuss our certification process. And then I'm not going to cover four. That's a more in the weeds kind of conversation, but I can tell you basically what it's about. So go ahead to the next slide. Thanks. So the first thing I wanted to ask is who's in the room. And so what I would like to do is ask you to put in the chat who you are and what kind of role you have in your organization. And it may not be one of these, it may be something completely different. I'm really interested to know who you are and what you do. So if you could take a minute to do that, that would be really great. Okay, so as you're doing that, I'll go ahead and start. Um, uh, so you can go ahead and forward to the next slide. So what is what we call Children and Youth Behavioral Health Initiative? Here in California, in 2021, the governor launched an historic 5-year commitment to, as he frames it, reimagine and transform the way we support children, youth, and families. And he committed $4.7 billion to that effort. It was an enormous amount of money that supports expanded Medi-Cal services that are what we call subclinical services under something called the multi-payer fee schedule for both public insurance under Medi-Cal as well as for private insurance companies. So it's the first time the state has ever obligated private insurance companies to have to cover services for children and youth. The initiative itself reimagines a more integrated, youth-centered, equitable, and prevention-oriented system. And he's very serious about that. And the wellness coach is an example of that commitment. I'm not going to read the whole slide to you. We're going to provide this to you later. In fact, Francis, if you want to go ahead and drop the attachment in the chat, I don't know how that works, but you're very welcome to share it and people can look at that and review this information in more detail. But the basic thing is that we're building on a foundation for equity and accessibility to meet children and families where they are and help them win where and in a way that's that they need it the most. So that is what the pardon me, the Children and Youth Behavioral Health Initiative is. Next slide. So it's our work and the work of the larger initiative is to align health and education efforts to support kids' learning. And so that's done through looking at how do we recognize collectively the social and emotional well-being and behavioral health impact, and it's on children's ability to learn, a student's ability to learn. Um, uh, there are deeply shared goals of education and health systems for children to learn and thrive. And we are taking a whole child approach in our community school initiative, as well as other opportunities like expanded learning opportunities, universal pre-K, and the Children and Youth Behavioral Health Initiative. Next slide. So as I mentioned, CYBHI is huge, and this gives you a feel for all the different components of this very large initiative. And in that left-hand upper corner is the wellness coach workforce that we are doing at the Department of Healthcare Access and Information. And we are doing other things in this quadrant, this purple and pink quadrant as well. And you can review those at your leisure. Next slide. So we recognize that schools are really an important part of the children's ecosystem for emotional, mental, and behavioral health. And so some important parts of what we're doing is, I mentioned a new statewide fee schedule that we're developing. And it sounds kind of bureaucratic, but it's a way to pay for a lot of supportive services that have never been covered by private or public insurance before. We're building infrastructure through our partnerships with between education and service provision, and really taking efforts that have been gone on a much smaller base level in other states and countries, and scaling it to taking it to scale so that it serves all of California. We have something called Cal Hope, which is a virtual support for schools and for and obviously the students and parents of the in school that are associated with schools. I think I'll leave the rest for you to read on your own. But the big take home from this is that where we are is, as a department, is creating a career pipeline that brings people in as early as they can out of college or out of high school even, into associate degrees and bachelor's degrees to be in a pathway in the behavioral health workforce. Next slide. So I've mentioned our department. I want to just say a little bit about it because it really says something about what we're about and the commitments that we have made in our work. So we believe that every Californian should have access to equitable, affordable, quality healthcare provided in a safe environment by a diverse workforce. Next slide. In the office that I work in, which is called Health Workforce Development, we have two large responsibilities: develop, support, and expand the health workforce, and offer programs that provide financial support in accomplishing those goals. So in terms of expanding the workforce, our aim is to serve medically underserved areas, make sure that our workforce represents the California that it serves through racial and language diversity, and that we in particular serve the Medi-Cal members, insurance members. We do this through three strategies. One is educational capacity expansion. An example is, like, I'm working on a program to expand enrollment in social work schools across California. Another example is individual supports to pursue careers through scholarship and loan repayment. An example here would be a scholarship program that we're going to be launching in 2 months, well, April 1st. So, yeah, about 2.5 months for behavioral health uh, professional or individuals wishing to pursue a behavioral health profession. Very broad. And I'll mention it later again as well. And then we also build the workforce pipeline. And really what that means is that we enable colleges and universities to have supports that make it possible for college students to pursue their academic careers. So an example of that for youth who are system and justice and system involved is that we're providing mentorship and financial aid to students with a history of homelessness, foster care, or juvenile justice involvement that want to go to college. And we'll be undertaking that work for the next 3 years. Next slide. So as I've mentioned what the initiative is about and what our focus is on addressing factors that contribute to the mental health and well-being of children and youth. And to do that, we've been allocated almost $340 million to design and build the certified wellness coach profession. Next slide. So what's the problem that we want to try and address with a certified wellness coach? Well, it's our assessment that children and youth have inadequate and inequitable access to the behavioral health care they need. Next slide. So we've developed a vision and purpose for this work. It's to improve behavioral health and well-being of youth through age 25 by creating a type of provider that can support children's and youth's social and emotional development and provide appropriate referral services that can reach children in all settings. Next slide. So the role is designed to do a number of things. First, it's to expand the capacity of behavioral health resources for children and youth. Second is serving vulnerable populations where they are, and to engage directly with youth and children through age 25. We want to build a public behavioral health workforce that better represents the diversity in California. And we want to fill some important gaps that exist in behavioral health services. And that's a really key function for the new certified wellness coach. And we want to make it a desirable profession that also serves as a stepping stone for individuals willing and interested in pursuing advanced degrees. Next slide. So here, I just wanted to show briefly where the wellness coach fits in the delivery system to kind of give you some sense of what it's about. So on that left-hand column, you see certificate, associates, and bachelors, as well as masters. And the idea is that we certify qualified individuals that have either an associate or a bachelor degree to do the work of a wellness coach. And associate level is a wellness coach 1, an associate level or a bachelor's level is a wellness coach 2. And they do similar but somewhat different work based on how much education they have. And as you can see in the overall flow of things, right under them is the master, which is what's required to be a school counselor or school psychologist, and so forth, as well as clinical licensure staff, which also requires a master's, in some cases a PhD. Next slide. So this is the distinction I want to make between the Wellness Coach 1 and the Wellness Coach 2. Both require a high school diploma or equivalent. The Wellness Coach 1 is that associate's degree. The degrees that we're recognizing for students seeking to become a wellness coach is a social work, human services, or addiction studies majors, and 400 hours of a combination of field experience while in college, as well as work in after graduation. For the Wellness Coach 2, in addition to being certified as a wellness coach, 1, or having an associate degree in one of those 3 majors, they would have graduated with a bachelor's degree in the same fields, one of the 3 areas. And then they would have a total of 800 hours, again, made up of field experience and work experience. And when I say field experience, I mean like field practicum that you earn under the supervision of faculty and your work site. Next slide. Continuing on, the prerequisites for people who are entering the workforce or want to become a wellness coach who are already working are broader. So what I had just described is if you're, still in college and trying to figure out if you want to be a wellness coach, those are the conditions that apply. For people who have been in the field for a year or two, who want to direct their attention to becoming a wellness coach, there are more recognized degrees. So in addition to the 3 degrees that I mentioned earlier, we also will recognize child development and early intervention, psychology, and sociology. The field hours and experience, though, is significantly higher because this is work that it would not have been supervised in their educational experience that we can verify. So instead, we're saying 1,000 hours. That's approximately 6 months of work. So we believe that's not a heavy burden, and that work be done in the mental health, social work, child welfare, or addiction, substance abuse area, and preferably with children and youth, obviously, because that's who the certified wellness coach will be working with in the field. Bachelor's, it's very much the same. It's the same majors, and instead of 1,000 hours, it's 2,000 hours. That's approximates about a year of work. Again, in the same fields, and we would hope with children and youth. Next slide. So what is it that a wellness coach does? So what we want is to ensure that the certified wellness coach has the competencies to be able to do wellness prevention and education, screening, care coordination and extension, individual support, group support, and crisis referral. And I think what's really important to call out here is that individual and group support is probably the areas that are most important in our minds for the work of a wellness coach. This is where you really are working directly with children and youth, assessing, if they're stressed, what they might be stressed about, and doing some intervention around that. Like if they're having trouble sleeping, teaching sleep hygiene. If they're worried, give them some tools to help with anxiety. And then we also call out some specific competencies that are really important to us: cultural responsiveness, humility, and mitigating implicit bias is very important, as well as professionalism, ethics, and legal mandates, and communication and being able to operate in different settings is really important. They could be at the school and they could be in the community working with a student and their family. Next slide. So this is a good reflection of the details that I was trying to articulate a moment ago. So I'm going to start with Tier 3. So this is that MTSS that I referred to. I'm not going to talk a lot about, but we do some assistance at Tier 3, which is primarily supporting school counselors, school social workers, and school psychologists, doing that crisis referral and that care coordination with students. In Tier 2, it's doing check-in, check-out with students, helping to identify the students that need that Tier 3 level that I mentioned a moment ago, and helping with life skills, as I mentioned earlier, stress management, time management, problem solving, and assisting and leading group interventions. And an example there that I find particularly interesting is the mental health first aid work that some of you may know about. That is a really nice way to educate students about what is mental health and taking care of yourself. And then Tier 1 is that very broad level of supporting universal screening, using a universal screening tools, teaching and reinforcing classroom social, emotional, and behavioral lessons under the guidance of the mental health or PPS staff. And I'll talk more about supervision in a moment. And other things like anti-bullying programs. I'll leave the rest of it for you to read. Next slide. So sort of this is that big picture. So Tier 1 is for all students, Tier 2 is for some, and Tier 3 is really for a few working closely with the school personnel, like the pupil personnel staff. Next slide. So this is a way to describe what a huge undertaking it has been to stand up this new profession. So it's been almost a year now that we launched our marketing effort. We have a new website. I'm going to drop the link in the chat. If I can type at the same time, I don't know. Yeah, I can type. Just bear with me. This will be a very useful website for you to have. So as part of our marketing campaign, as you can see in December, just 2 months ago, we launched a new website. And this website is sort of soup to nuts of everything you would want to know about the wellness coach from the perspective of the potential student or person who wants to become certified, to a potential employer and what you might want to consider in employment. And then about how do we stand up the educational opportunities for people who want to go back to college or continue their education. The grant program, this is a really big deal. So we just launched a $120 million grant to support employers in hiring wellness coaches. So we're spending $120 million of that $338 million that I mentioned earlier to fund schools, school-based clinics, school-linked clinics or organizations to hire wellness coaches, to provide stipends to wellness coach interns, as well as to pay for supervision of those individuals. And I really want to stress that I don't know enough about your individual roles that you described for me, but I think some of you may want to, if not directly through your employer, talk with them about the opportunity for funding. And if you go to cawellnesscoach.org, that should link you back to that funding opportunity. We also just launched on the 15th, which is just a week plus ago, our certification website. And that is a place where you would go if you either have the college degree of social work, human services, or addiction studies as associate or bachelor level, or you have that work experience combined with one of those 6 college majors. Visit the certification site and see if you can't get certified right now, because the grants that we're going to award, those organizations are going to be looking to hire people who are certified to work in their sites. So it's a really great opportunity. For those that are planning to continue on to college or are in college, we have mid-24, it's actually April 1 of 24, we are launching our scholarship opportunity. And this is going to be $35,000 a year scholarships, very rich scholarships compared to what is offered in other situations. And the commitment is that you will be a wellness coach when you're finished with your degree and service obligation. Each year of a scholarship carries with it an obligation to practice in a site where you would typically hire a wellness coach, as well as has the potential for, so you might work in an HQ, federally qualified health center, FQHC, or or an after-school program. Given the audience here, I'm going to emphasize that after-school programs could be eligible if they're if obviously they have a direct relationship with their educational setting, so that would work. On the education side, what we're doing is we are partnering with community colleges and state universities to help them refine their those 3 degree programs to ensure that they have the coursework that prepares someone to become a certified wellness coach. So I think I'll go into that later on. And then I mentioned earlier about the Medi-Cal. So what's really important to us is in this current grant that is underway, that will announce grantees back, as I mentioned in the second teardrop, in May, we'll announce those grantees. Well, they're going to want to know that they can continue employing the wellness coach. And this is where the Medi-Cal and private insurance coverage is so important. And we're working with our sister agency, the Department of Healthcare Services, to roll out the Medi-Cal coverage piece. Next slide. So I've mentioned a lot. So I've covered a lot of this territory, as is my want to do when I'm going through that other slide. But I want to call out a couple of things here. One is who is eligible for this employer support grant. Local education agencies, county offices of ed, school-based early education agencies. This is Head Start, as well as school-linked and school-based, community-based organizations, very broadly defined. And not listed here, but also eligible are higher education, community colleges, and state universities, even private nonprofit universities, may want to set up a wellness program and employ wellness coaches for their students, because obviously the average person going from high school into college within a year or two of graduation will probably be qualified for services throughout their education. Next slide. So I've covered a lot of ground. So I think what I'll do is just open it up, and if you would, I'll turn back to Frances to ask her how you want to do this, if you have an opinion.
I don't, whatever
Okay.
you're comfortable with.
Okay, so I think what I'll do is, if you wouldn't mind raising your hand, I think, yeah, the reaction button, there's a hand raise symbol, and then I can call on you, and I'll happy to answer whatever questions I can. I've covered a lot of ground, and at the same time want to be sure I meet your information needs. No questions? Okay. Well, I think I get to give you back a half hour. Any last thoughts? Oh, I appreciate that, Erica. Let me also drop in the chat. I'm going to see if I can do this smoothly, if I can get my computer to wake up. Oh, there we go. What I want to do is give you the website. Copy that. I'm going to drop this. Yeah. Okay. So this website that I just dropped in the chat is for our certified wellness coach area in the HCAI website, and there is a lot of information here. It describes what a wellness coach is, how to become a wellness coach, and it also lays out the Certified Wellness Coach Employer Support Grant Program that I've talked about. And then there are some additional resources about how to become a wellness coach. And then, of course, I mentioned the cawellnesscoach.org website. That's a great resource as well. And with that, I'll turn it back to you, Frances.
Great, thank you so much. Are there any questions from anyone? You can put them in the chat, or we have lots of information here. Just want to make sure we can answer any questions that you all have.
Great. Appreciate your time. I know you could be a lot of different places, so I really do appreciate it. All right, we'll close it out now.